You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to one of our favorite vets, Dr. Laura Brown, owner of Green Tree Animal Hospital in Libertyville, Illinois. Dr. Laura Brown is going to answer a question from our listeners. Welcome, Dr. Brown.
Hi, Polly.
Thank you for being on the podcast.
Absolutely. Love it.
So the question today is, what do you do when a dog cracks a tooth?
Okay, so that it kind of depends on which tooth and how bad it's cracked, because dogs' teeth anatomy is just like people. If you break the crown, the part, that we all brush, and it breaks too far down, then you expose the sensitive pulp cavity, which is the highway down to the nerve, and that's the painful part. Usually if you break it that low, there might be a little bleeding. And those teeth are then painful for the dog for a little while. So ideally, in a perfect world, that tooth, like it does in people world, gets a root canal. However, that's a pretty expensive specialist procedure, so that doesn't always happen. And if it's a little tiny incisor tooth, one of the teeth in the front, on the top and the bottom, they're only one rooted teeth, and they're not super important as far as for dogs, as far as their cosmetic look goes and or eating. So a lot of times those teeth just get extracted.
Okay.
However, there are 4 really important teeth. The canine teeth, so the big fang teeth on the top and the bottom, there's 4 of those. And then there's 2 big premolars on the top, in the back, one on each side. And there's also 2 really big molars on the bottom. So if one of those teeth get cracked, it's they're multiple rooted teeth. So sometimes it's advantageous to seek out a dental specialist and have a root canal.
Okay, and then they would just leave that space open.
So when a root canal saves the whole tooth, and so there's no space, but once again, specialists, expensive. Us regular GPs end up extracting teeth in that situation, and sometimes we extract teeth not just because they got broken, because they're infected and got wiggly and mobile. And those, once you pull those teeth, then there is this space. But dogs' teeth don't shift like people, so their jaw stays the same. And so we don't worry about those spaces. Okay.
Yeah. I mean, hence Chuck the pug, who has about 3 teeth left.
Right. So he still eats just fine, right?
Yeah, inhales.
Yes. So, I mean, there's lots of teeth in there. They are much better off without their teeth if their teeth are painful. So painful because of infection, painful because they're loose and wiggly, painful because they're broken and the pulp cavity is exposed.
Okay.
They're much better without them than living with them that way.
So the best thing is, like sometimes I've heard people talking as they're hiking down a trail saying, oh, my dog, was chewing on a log and lost a tooth, or the tooth is cracked. So the best thing is just to get to a vet.
Yeah, get to a vet and see how far down is it cracked. We see probably the most common tooth that gets fractured is the top 4th premolar. So it's the biggest tooth on the top and it sticks out the widest. So dogs can break those teeth chewing on nylobones, or around here a lot of people like to give their dogs deer antlers. They're pretty darn hard. Mm-hmm. And so it doesn't have to be a big log in Colorado, but it's pretty easy for that tooth to get a slab fracture, pulp cavity is exposed, and that tooth needs to come out. I will say a lot of people don't notice those things.
Yeah, I was going to ask, how do you notice? I mean, because it's not like it's bleeding or...
Yeah, you either have to look, because the dogs do not stop eating because their tooth's broken. They do not stop eating when they have a loose tooth. They do not stop eating when there's a lot of periodontal disease. Just like you don't stop eating when your tooth hurts, or you keep eating, you just move stuff around and get on the side that it's not going to be painful on. But dogs suffer in silence, I think. A lot of dogs suffer in silence. So I'll get on my soapbox and say that's why you should take your dog to the vet for their annual checkup, and a semi-annual checkup if your dog's a senior, because we look in their mouth and do a dental exam at every exam. And that's how most of the time we find it, is us veterinarians look for it.
Okay. Well, thank you for being on the podcast, and hopefully our listeners will take their dogs to the vet semi-annually and annually, especially for dental.
Exactly. That would be awesome.
Thank you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.